everyone, welcome back to my channel. It's Sheila G, the PAC, and today we're getting into one of the most frustrating skin conditions, urticaria. I'm sure at some point in your life you've experienced a hive, maybe many hives, maybe you get them all the time for no apparent reason. This development of hives is called urticaria, and today we're diving into what causes urticaria, what triggers it, all of its many variants, and the currently available treatments. Before getting in, of course, don't forget to like, comment, and subscribe to my channel for all things dermatology and skincare. Now let's go. So urticaria happens when mast cells, which are a type of immune cell in the skin, activate and release histamine, most commonly in response to an allergic reaction or even an infection. There are some other things that can lead to this activation, and we'll get into that shortly. But this release of histamine causes blood vessels to dilate, fluid to leak out into the skin, and nerves to become irritated, and that leads to the development of those itchy, red, raised bumps we know as hives or wheals, and these typically go away within a few minutes to a few hours. Sometimes angioedema, which is rapid and deep swelling of tissues beneath the skin or the mucous membranes, can happen along with urticaria, or it can happen on its own, but this becomes an emergency when it affects the airways, and we'll get back into that too. To get a better understanding of how this happens, let's go over how histamine is normally released in the skin during an allergic reaction. So when you come in contact with an allergen, IgE antibodies are produced by your immune system in response. These IgE antibodies attach to specific IgE receptors on the surface of the mast cell, and this attachment acts as sort of a loaded weapon per se. And when you come in contact with that allergen again, that allergen binds to that IgE antibody that's already attached to the surface of the mast cell and causes the mast cell to activate or degranulate, which means that it releases histamine and other inflammatory chemicals into the skin. So in acute urticaria, which is the most common form, external allergens like pet dander, pollen, certain medications, or even certain foods like shellfish trigger this IgE reaction. And I have a list of all of the most common triggers of urticaria. But also, certain infections, like viral infections, especially in children, can trigger this release of histamine as well. But it does so through a different mechanism, not through IgE, but other immune responses. So just to summarize, in acute urticaria, there's typically a known cause. So either a true allergen, which acts through that IgE binding and releases histamine that way, or something like an infection, which triggers a different immune response that activates those mast cells to release histamine. Now, in chronic forms of urticaria, where the development of hives is recurrent and persistent, it's not an external allergen that triggers this reaction. Rather, it's either an autoimmune or some sort of internal activation that leads to the development of hives. And so now let's go over all the different types of chronic urticaria. I'm going to try to make this not confusing, but first, there's chronic spontaneous urticaria, and that has two different subtypes. So the first subtype, or type 1, is autoallergic urticaria. And this happens when the body produces those IgE antibodies, but instead of producing them against an external allergen, it's producing them against the body's own cells and tissues. And so a common example of this would be those IgE antibodies formed against thyroid peroxidase, which is an enzyme produced by the thyroid gland. So again, these IgE antibodies are formed against a normal internal allergen instead of something external. The second type is type 2b, which is autoimmune urticaria, and this happens when the body produces other antibodies, such as IgG, not IgE, and these cause the mast cells to activate and release histamine. So that's chronic spontaneous urticaria. Another type of chronic urticaria is known as chronic inducible urticaria, and that's when more physical triggers lead to the release of histamine. So think heat, cold, pressure, sun, even water can cause that reaction. And we don't exactly know why that happens or why these particular physical triggers lead to the release of histamine. But you might have heard of dermatographism before, and that's when hives develop in areas of the skin that are either scratched or rubbed. So you can literally draw on the skin, and those hives are going to develop directly in that area of pressure. Now going back to angioedema, which is that deep and rapid swelling of the underlying tissues and mucous membranes, this can happen either in acute allergic reactions or chronic forms of urticaria. About 40% of patients who have chronic forms of urticaria develop some form of angioedema. And as I mentioned before, when it affects the airways, this is an emergency and requires immediate medical attention. So how do we diagnose urticaria? In most cases, the diagnosis is clinical, which means that it's only based on the physical exam and the patient's history. Usually labs are not necessary. In acute forms of urticaria, most of the time we can figure out the trigger, but in chronic forms of urticaria, a lot of the times it's idiopathic, which means the trigger is unknown or it's an abnormal immune response. But if further investigation is necessary, these are the labs that would be reasonable to order. It's also important for me to say that patch testing, which is either done through an allergist or some dermatology offices, is not helpful in the diagnosis of urticaria specifically, as patch testing is only going to test for type 4 delayed hypersensitivity reactions, so like allergic contact dermatitis, and those are T-cell mediated and not IgE mediated. So now let's talk about the treatment of urticaria. The first-line treatment for both acute and chronic forms of urticaria are second-generation antihistamines like Claritin, Zyrtec, Allegra, or Xyzal. Now, these are preferred because these types of antihistamines don't make you drowsy like Benadryl does. Now, there is a prescription antihistamine called hydroxyzine that sometimes we'll prescribe, but this one is only for cases where the preferred antihistamines are not sufficient, as this is another type that can make you very tired. For acute urticaria, most cases go away on their own, but antihistamines help with the itching and the swelling. In more severe cases of acute urticaria, a short course of oral steroids like prednisone may be prescribed. For chronic forms of urticaria that are uncontrolled by antihistamines, there are some more aggressive options, including biologics such as Xolair, which is an injection that targets IgE. Another biologic is something we actually use all the time in dermatology, and that is Dupixent. Dupixent is indicated for atopic dermatitis or eczema. Again, it's an injection medication, but it's now approved for chronic spontaneous urticaria. And in more severe cases that are refractory to these treatments, there are immunomodulators like cyclosporin. So there you have it, acute and chronic urticaria. I know this topic can be quite confusing, so I hope I made it a little bit easier to understand. Thank you guys so much for watching, and of course, don't forget to like, comment, and subscribe to my channel for all things dermatology and skincare. I'll see you in the next one.